Hi, it's Naresh the Orthodontist, and for today's video I'm going to talk about orthodontic implants, better known as temporary anchorage devices or TADs. These are small but often critical additions to modern brace treatment and aligner treatments. TADs are tiny titanium screws placed into the jawbone and act as fixed anchors for moving teeth towards the direction we want or preventing unwanted tooth movement. Essentially a discreet handle for your orthodontist to gently pull against, limiting forces on other teeth or relying on unsightly headgear. If you know, you know. Commonly I use them to close large or old spaces, correct overbites or open bites, intrude push-up or extrude pull-down teeth, and generally move teeth that otherwise wouldn't budge predictably. They are temporary and removed once the job is done. Placement. This is done normally in surgery with a tiny amount of local anaesthetic, and in just a few minutes they are placed. There is no cutting or stitching in most cases, and most people describe the feeling of placement as pressure and not pain. Risk and possible complications. TADs are generally very safe, but like all procedures, there are some risks. Commonly, soreness for a day or two, mild swelling or redness, and the gum around the TAD can be irritable. Less common, loosening or failure. This is the most common problem with TADs. Usually painless, and TADs can be simply replaced if needed. Other issues such as localized infection or inflammation can be prevented with good hygiene and cleaning. Rare complications. Tooth root contact or root damage, mostly avoided with proper placement. Nerve irritation, very uncommon due to placement planning. It's important to know that TADs do not fuse to the bone like dental implants, and hence are temporary and minimally invasive. Post-op care, this is the bit that matters. Good care is important for high success rates. In the first 24 to 48 hours, expect some mild soreness. Ibuprofen or paracetamol usually put an end to that. Avoid touching or wiggling the TAD. Limit yourself to soft foods if sore. Oral hygiene, brush gently around the TAD at least twice a day, using a soft toothbrush. Sometimes warm salty water mouth rinses a few times a day can also help. Some orthodontists prescribe chlorhexidine mouth rinses for a short period of time, but I generally don't find this is needed. What to avoid? Please don't chew on it. Avoid sticky and hard foods, pulling on the area, and don't play with it with your finger or your tongue. When to call your orthodontist? If there is increasing pain after 3 days, there is swelling, pus or persistent redness, the TAD becomes loose or falls out, and when it is painful to bite or move teeth nearby. When we have finished with the TADs, removal is simple, quick and painless. There is no permanent damage when properly used, and failure doesn't mean treatment failure. It simply means that we will replace the TAD. I hope you found this short video useful. Thank you for watching.